hand. So when we get into the hand, we have a set of wrist bones, correct?
Yes.
And what are those called? Those are called carpals. When you go from the carpals to this area, what is this called?
Metacarpal? No.
Metacarpals.
Oh, yeah.
And you get into the fingers, and they are known
Did-
as phalanges.
Phalanges.
Now, you don't need to know all the details of the carpals, but when you get into anatomy, you do have to know the first 4 rows. And there's specific names.
Bones, yeah.
Like pisiform and hamate, just different things like
We
that.
actually named them on
Yeah.
our lab, and then asked her if she was gonna have us name all the carpals, and she said, probably not, but.
No. Usually they only ask you for the first 4 and 15,
I was like,
or sometimes none. And then after that, anatomy will ask you for at least 4,
Right.
minimum. Okay? So then let's move on to the pelvic girdle.
This one's the.
Oh, it's okay. So what is the pelvic girdle?
Can I see the mirror?
Yeah, let me just take a picture of it.
A pelvic girdle.
That's
That's what I have questions
what is
on,
that bone?
actually.
That's the hip bone, okay? So what are the 3 bones that make up the hip bone?
The sacrum, the hip bone, and
The ilium,
The ilium.
the ischium, and the pubis.
Pubic.
Pubis. It's just called pubis. The pubic symphysis is actually a joint. So if we were to put these and articulate them, what kind of pelvis are you think you're looking at right there? Male or female?
Female.
Male. Now
Oh.
why? Why is it male? Right, it's narrower. The ilium is not flared out. The pelvic brim isn't big and wide. Right? Okay. So then we have this opening. What's this called? It's the second biggest foramen, and it's called the orbiter.
Orbited form.
Orbiter, however you want to do it. Tomato. Anyway, so what are the 3 bones that make up this area?
Ischium and the.
Ilium and the pubis. And what is this called?
That's the actival.
Acetabulum. Very good. That was good. I know that word's weird. So what do you think? How, if you were looking at this, could you tell if you've got it on the inside or the outside, or if it's in the wrong direction? What articulates it?
The femur.
Okay.
So that's the
That's
right
together?
side.
Okay, so that's the right thing, right?
Yes.
Okay. So another distinguishing feature, if you want to make sure that you've got it in the right direction besides just this, because this is always going to be lateral. This is always going to be to the medial side, facing the medial side. The head is always medial. Head is always medial.
Okay.
Another thing that you can, when you're looking at a hip bone, know if it's lateral or medial side, is this is always on the medial side. This is a tuberosity. So when it comes together, the little joint that's in the middle there is called the pubic symphysis. Okay? So there's the acetabulum. Okay?
Mhm.
Do you want to pass these around?
Can I ask a question?
Uh-huh.
Can we look
Sure.
at this? Because this is what I got confused. I don't even know. Because it's asking for the muscles, and it says to ID the muscle that attaches to the point, and I wasn't sure. And then it's asking the muscle that's a synergist and antagonist.
So what's the synergist muscle first? That's an assisting
One that
muscle,
works
right?
together, yeah, and then the
Right.
antagonist is ones that help,
Resist.
right, or resist,
Resistance.
right, so if you're
Resistance,
going,
right.
yeah.
Okay, so we're going to do the bones real quick, and then we're going to
Okay.
move on to muscles. Okay, so how would we be able to tell if this is right or left?
The medial,
From the head,
the
right?
head, right, if it's,
Okay, so the head's always going to be the medial side, so is this a right or left leg?
right.
So what if it was sitting there like this?
It's not, because it's not flat on the top.
But if it had it on a table, like if
Uh-huh.
she had it on a table like this.
The
how
U
would you
is
tell
stick up?
Right.
On the bottom, or the.
Right,
'Cause you
so
can't
this
bend
is the
your leg.
proximal point, and this is the distal point. So our our hip ball doesn't go out this direction, it goes in this direction, right? So in your mind, you need to flip it over. So you know this is an anterior view, right? Okay, so this is proximal and this is distal, right? Okay, Does she want you to know the features at the end, the distal end of the humerus? Like, does she want you to know the epicondyles and the condyles?
I did name that in my
Okay,
study.
so these protrusions on either side of the distal end of the humerus are called epicondyles.